Hi, we're from Group C12 doing Psychology and Lifespan Development. I'm Joshua Sanders. My number is 1077077 and I'm majoring in paramedics.
Hi, my name is Tangi and my ID number is 0178830 and my major is occupational therapy.
My name is Wani, my ID number is 1074913 and my major is nursing. Seeks to impart to the client new knowledge, information and meaning that is relevant to their needs, interests, in terms that the person can understand and in a manner that enhances the person's need to participate in the learning process with self-directed activity.
In practice, an informative intervention seeks the healthcare professional explaining to the patient what is going on with the patient's body and what the care plan and expectations are for the long term.
As a health professional, we need to ensure that all the pros and cons of the patient's care plan to allow them to make an informed decision with regards to how the care plan will proceed. Informative intervention is essential to the job of a paramedic because you need to inform the patient of how they are going, where they are going, what you are doing to them and what you plan on doing to them. Also the possible treatments and other practices that may occur to them over the span of getting treatment.
An informative intervention is important to nursing because it allows you to fully inform the patient of their care plan, how they are doing currently and what your expectations are for their future treatment.
Informative intervention is important for an occupational therapist interaction so that the client has a clear understanding of the treatment through his or her recovery.
Hi Josh, I imagine that you're feeling pretty worried right now about your knee, and there are a number of treatment options available that can help you get back to full fitness.
Thanks, I am worried. What are the options available to me?
There's surgery and rehab. We'll get the doctors to come by and talk to you about both options, but here's some pamphlets that can help you try and make a decision and have any questions ready for when they come to talk to you.
Thanks, I'll take my time to review my options. Are there some numbers where I can contact the relevant people?
Yep, here they are, and I'll make sure I arrange for them to come by and see you this afternoon. If you've got any more questions, don't hesitate to ask.
Thanks, that'd be great. So I see you've been in an accident. How do you feel?
My neck hurts. I think I've injured it.
Yeah, I can see some bruising starting to occur and I think we may have to take you to hospital.
Is she going to be okay?
I can't say for sure now, but normally people make a full recovery from these sorts of injuries.
Well, it's a good thing.
Yeah, it is. Now we'll take you to Middlemore Hospital where the specialists can have a look over and give you their personal opinion.
Great. A catalytic intervention seeks to elicit self-discovery, self-directed living, learning, and problem-solving with the client. This type of intervention seeks to use the client's own experiences to create a treatment plan for the future. This involves a health professional and the client sitting down and drawing up a lifestyle map.
The lifestyle map seeks to show all the aspects of the client's life that are both active and not active in, the person's satisfaction level in the activities, and whether or not the person wants to change the situations. How the catalytic intervention proceeds will be directed by the person's age and physical or mental abilities.
A catalytic intervention is based on interpersonal communication between the health professional and the client or guardian. This type of interpersonal communication takes place by asking open and closed questions, echoing by repeating the last words spoken by the client, or in the middle of the client's sentences to encourage discussion between the client and the health professional. The health professional will also look for non-verbal cues, looking at the patient's facial expressions and body language. The health professional can use these cues to understand the patient's current state, how they are progressing, and how to proceed further. The use of catalytic interventions in a paramedic's practice is not a well-used or appropriate intervention. The time that paramedics spend with their patients is not often a long time and can be a time filled with rushed treatment and care. The catalytic intervention involves self-discovery and the opportunity for the patients to plan ahead and discover themselves. This is not practical for the paramedic's practice.
A catalytic intervention is important to nursing as it allows both the client and the nurse to work together to form a long-term plan for the patient's care to allow for a common goal to be achieved.
Yep.
Catalytic intervention is a significant role in occupational therapy. The occupational therapist is required to work alongside the client, analyzing the client's psychological and physical state and living environment, then using this information to plan a care plan for the client to follow. Hi Josh, my name is Tangi. May I have a moment of your time?
Yeah, sure. Nothing else to do at this place.
Thanks for agreeing to see me. I'm an occupational therapist and I'm here to help you in your recovery. How's it going so far?
I feel a bit drowsy and my knee hurts.
It's expected. You just had the surgery. Are there any other medications helping?
Can't tell. Could do with a higher dosage though.
Sorry, you'll have to speak to your doctor about that. Is there anything else I can talk to you about? Any worries, any concerns?
Well, I'm worried I'm not going to be able to run as fast as I used to, play soccer the way I used to, or even just walk straight.
I can understand how you feel. I too had a knee injury, and I went through the same thing. I feared my leg would be shorter than the other. Mind you, though, it did make me feel cool though, you know, with the gangster sort of walk, you know. Anyway, thankfully my team who were looking after me at the time was good at what they did. So I'm here to make sure that you get the same treatment.
So there's hope for me?
Definitely. I can show you safety techniques to make sure that you don't do any further damage to your knee. I can help you achieve the things you can find difficult in doing, like bathing, getting in and out of the bath, and getting dressed. With your cooperation, we can work together and try to come up with ways to help you get back to doing the things that you like doing, like playing soccer.
Great.
Good. Shall we get started then?
Yep. Interventions are a form of interpersonal communication between the health professional and the client. All stages of intervention need to be handled with care, taking into account the client's age and mental ability. How any intervention is initiated and carried out is governed by the Health and Disability Act, which ensures that all clients have
the right to be treated with respect,
the right to freedom from discrimination, coercion, and harassment and exploitation,
the right to dignity and independence,
the right to service of an appropriate standard,
the right to effective communication,
the right to be fully informed,
the right to make an informed choice and give informed consent,
the right to support,
the rights in respect of teaching or research,
the right to complain,